Pregnant women may want to think twice about taking a very common over-the-counter drug. A new study shows a link between maternal use of Tylenol or acetaminophen and their kids having ADHD. Joining us live now to talk about the findings, the lead author of the study, Brannon Baker, a postdoc fellow from Seattle Children's Research Institute. Brannon, thanks for your time.
Hi there, thank you.
Hi, so you looked at gestational exposure to acetaminophen, the key ingredient in Tylenol and generic versions. What did you discover?
Right, so this study concerned acetaminophen, which is the active ingredient in Tylenol, as you said. It's also the active ingredient in other medications to treat cold, pain, and fever. And we found that use of acetaminophen during pregnancy was linked with higher chances of the child developing ADHD.
How much higher?
In this particular study, if we found acetaminophen in the blood of the mom during pregnancy, there was a 3 times higher risk for the child to develop ADHD.
So how many people were in this study and over how many years? Because you want to know, was this a lot of people?
Yeah, that's a great question. So in this kind of study, we enroll individuals during pregnancy. We collect a lot of data on them, and then we follow up the children. In this case, we had just over 300 participants in this analysis, and we followed up the kids when they were 8 to 10 years old.
Got it. Okay. But this is alarming, right? And it got a lot of attention in the sense that Tylenol, acetaminophen, is usually the pain reliever doctors tell you to take when you're pregnant. I remember when I was pregnant, right, it was deemed safer than ibuprofen, for example.
Yeah, absolutely. It's incredibly important that pain and fever are managed during pregnancy and in the safest way possible. And in general, you should not take NSAIDs like aspirin and ibuprofen during pregnancy because they're linked with some other adverse outcomes.
Right. So then, since this study has come out, though, I guess before we get into whether people should take it, is it causal or could it just be a correlation? And also, were you able to narrow it down to a subset of women?
That's a great question. In any kind of observational study like this, we're looking at correlations. We're trying to get causation the best we can by controlling for a lot of factors. So we control for whether or not the parents have mental health conditions, and we control for other factors to make sure we're trying to get the best causal association we can. And we also have many, many other studies that have looked at a similar question. So there's kind of a consensus of scientific evidence with many different studies across different populations, really across the world, that have shown a link between prenatal acetaminophen exposure and adverse neurodevelopment, including ADHD.
So it sounds like you're saying you're pretty sure it's causal, but I'm not hearing 100%.
Yeah, that's absolutely right. I mean, with any sort of study like this, we think we're seeing something real, but there's always room for more research.
So were you able to narrow it down to a subset of women, whether it's age or race, or were you seeing it more in boys or girls?
Yeah, it would be great to have future research looking at which subsets might be more susceptible. It was previously thought that it matters why you're taking acetaminophen. So if you take acetaminophen for a virus or a cold you have, maybe it's the virus causing ADHD, or maybe you take acetaminophen for migraines. And so that's been a concern in the past. But studies have shown that no matter why the individual is taking acetaminophen, we see the same risk for child ADHD.
Okay, so since ADHD has already been on the rise in this country for a few decades, I guess the question is, should women, pregnant women, avoid taking Tylenol for now or generics?
It's a great question. I mean, for pregnant individuals, we really recommend that they need to consult with their clinician or doctor, especially if they're going to plan to take acetaminophen on a long-term basis. My main recommendation is that really we should make sure we're using acetaminophen for the right reasons. So prior studies have shown that acetaminophen is not effective for lower back pain, for example. That's been shown in some really big clinical trials. So it's possible people are taking it for that reason. And in that case, it's really an unnecessary risk. If there's a possible link with adverse neurodevelopment, why take it when it's not actually going to provide relief for something? Now, if you use it once or a few times during pregnancy for a fever, that's the correct use. So really just make sure you consult with your doctor, especially before you use it on a long-term basis.
In the 30 seconds we have left, what are the next steps for this scientifically, if you're going to study it more?
That's a great question. The next steps, we want to see if different subsets of people are more susceptible. So it's possible people with certain genetic background or certain nutritional profiles might be more prone to this adverse link, and some people might be protective if they have a really good diet or they get lucky with the genetic lottery.
Right. All right. Brandon Baker, postdoc fellow from Seattle Children's Research Institute, with this important study about the link possibly between Tylenol, acetaminophen, and ADHD in children. Thank you so much. Really appreciate you coming on.
Thank you.